part of my job as moderator is to sort of synthesize and summarize, but I mean, he did such a wonderful job at the end, Moshe. It's hard to do. But let me just reflect back on a couple of things and sort of maybe tie some threads to what we heard yesterday and talked about. I think this notion of be deliberate. There are different styles, but at least recognize when you're doing what and which style is really, really important. I mean, I'm certainly a conflict avoid. My wife always says, by avoiding conflict, you create more conflict. I hear that a lot. And it's actually a real true statement. And I think a lot of us do that. That's why I asked the technology question, particularly because, I think a lot of people use email to avoid conflict. I get a lot of email from people saying, would you please do the following? Because they don't want to call me up and say, would you please do the following, right? So I think that's a really powerful learning. And the other big theme, the second big theme, was focus on interests rather than positions. Now, I thought the exercise was fascinating, and it really, I'm working with some colleagues at the Kaiser Policy Institute on a piece of research that we did with our colleagues at Harris with focus groups of physicians, right? And they're going to use this data in a book that Jack Cochran, who runs the Kaiser Permanente Federation, he's a surgeon, chief doctor of the Federation of Kaiser folk, about where physicians are in this journey right now. And the little case study we did, I think, was absolutely brilliant and real, right? I mean, that's your life, of dealing with clinicians. One of the things that was really, really, really powerful in the focus groups that you don't even pick up on surveys is the vehemence with which physicians resent the notion that fee-for-service medicine is at fault for all that's going on. They really take offense to the notion that, policy wonks say we've got to move from volume to value. We've got to move to some other payment system. They take great offense at that, and that's one of their interests. And it's not just about the money; it's about the assertion that somehow they're not doing it for the right reasons. The other thing they get very, very upset about is the malpractice issue. I always say that, if I'd been advising the president, which I wasn't, the first thing I would have done was do something about tort reform. Not because, and there's a huge disconnect in the policy community. I mean, the smartest people at Harvard will tell you it's a tiny sliver of effect, but, anybody who's ever worked with physicians, Brian, you know this better than anyone, anyone who's worked with physicians is, I've given hundreds of talks, thousands of talks with doctors in the room. It's the first question you get asked. You didn't talk about tort reform. It's a big deal for doctors. And defensive medicine is a huge psychic load that they carry around. And so, again, to your point of interest, that's really a huge deal. And the other thing is that recognize, and this is true of all caregivers, we're in a time of high stress in the health system for all the reasons I started talking about. So it's not just doctors, it's nurses, it's every caregiver is under a sort of duress of trying to do more with less. It feels like that, right? And that's why I think one of the punchlines I always come to is, it's not about doing more with less, it's about doing things differently often. And that getting to a different way of doing things that resolves interest requires a negotiation that's quite complex. And I think you gave us some amazing skills, Moshe, to do that. Consider alternatives and options. Absolutely. I mean, you don't want to back people into corners unless you do, right? Unless you want to sort of say, look, some things are non-negotiable. I mean, we had this discussion yesterday about checklists. If the data are overwhelming, why are we negotiating this? So you've got to find some way to get people back at the table if it doesn't really work out the first time around. The brilliant thing about slowing down time, I think, that's why I asked the email question. I keep saying to my wife when because she is a former emergency room nurse. Need I say more? I mean, she likes to abuse customer service people for sport. I mean, it's the kids call her Attila the mum. She's a beautiful, sweet person. Don't get me wrong. And as she says, she also gives positive feedback. But she's a very direct person, and which is what I love dearly about her. But I keep reminding her that the way in which people interpret her email about a particular thing might not be the same as she intended. So this notion of using media. By the way, I got to tell you a wee story about the media thing. So I live in Silicon Valley, right? And so I was at this birthday party for a 16-year-old boy, for a friend of mine's son, a couple of months ago. And the hipster cousin, who's like 27 and lives in LA and is in the movie business, came up and was talking about, and so the kids are, no kid now even bothers using their cell phone. They just text each other, or they're on Tumblr or something. I have no idea about how it works. But anyway, so they're all sort of bragging about their Facebook friends and stuff like that. And then this really uber hipster kid from LA, who's 28 and in the business, he goes, dude, I've got this totally new thing I'm doing. And they go, what's that? He said, like I phone people up. Like I talk to them. It's amazing, man. I can, like I do it in real time. I talk to them. I'm going like, this is... I swear I came in the movie, I think, But this notion of finding the right media. Rely on objective criteria. I think we all get in these negotiations kind of inflamed, and data is a really powerful backup. Listen effectively as you negotiate. I think it's the one thing I've learned over the years in terms of I've facilitated a number of, multiple stakeholder meetings with pretty senior people. The best way to do that is exactly the set of skills that you gave us today, Moshe. It's listen and make sure people know that you actually listened to what they said. And I actually find taking, what they call active listening, of taking notes, is a really powerful way to make sure that you actually accomplish that. And too few people, I think, actually do good note-taking and really acknowledge what is going on. Understand and manage emotions, absolutely, because there is the natural... I grew up in Glasgow, which is the home of the street fight. Picking fights is really easy in Glasgow, and it usually starts with people rising to emotion. There's a thing in Glasgow called the Glasgow kiss, which is the headbutt. If you grew up in Glasgow, you learned how not to let emotion run away with you if you want to keep your teeth. The other thing we just got into in the Q&A at the end was this whole notion about context and strategic allies. I think that's a really powerful notion in all of the work that you do about trying to think through the other stakeholders, because the thing about healthcare is that it's immensely complicated. There are a lot of stakeholders with different motives. So you really have to sort of map out the kind of interests surrounding the problem you have. And that's true at the micro level, it's true at the macro level as well. And I really think that's important. But I'll tell you how I think you resolve all of that is, and I've seen this in great institutions, and I've seen it in the work here in South Carolina, you put the patient first, right? When you put the patient first, amazing things happen because it gives you power over almost everybody in the system because you're doing the right thing for patients. And I've worked with many great institutions that do that, and it's palpable when people put the patient first. It's not a slogan, it's a truism. It's what drives them, and I think that's, in terms of allies, there is no greater ally than the patient's interests. So that's my thoughts about what you heard today and some connections to yesterday. What we're going to do now is that we are going to break. There are box lunches available, I guess, in the meeting rooms, is that right? Or right outside? Right, out in the foyer outside, and you'll be able to get a box lunch. We're going to reconvene in your learning sessions from 11:30 to 2:30, so we've got a break right now for 45 minutes. Moshe's going to be here, I'm going to be here, and then we're taking off to the airport. We've got to go somewhere else. I can't thank you enough for your hospitality. I thank you for getting me to the concert last night. I don't know how it was a magical thing, but thanks so much.